Hi, my name is Nicole. I have ankylosing spondylitis, or more accurately, axial spondyloarthritis, which is an autoimmune disease. I got diagnosed properly a couple of years ago. I am 54 years old, and it took till age 52 to get properly diagnosed. Obviously, there were signs all along, but basically, it is an autoimmune disease. It is a type of arthritis, and it hurts really, really bad. Um, it's very high up there on the McGill pain scale because there's the scale where it helps rate the pain of the diseases and chronic pain, different ailments, a broken arm, childbirth, cancer, and so forth. And it's pretty high up there, like in the 30s. So it's a very, very painful disease. Yes, I am in pain right now. My SI joints hate me, and today the pain is the rib cage. Hurts. So basically, and this autoimmune disease thinks that your bones are being attacked. Let's say you break your bone. Your body sends signals to heal that bone, right? And that's why when they look at the MRI or the X-ray, they can see where a bone healed, so they know that it broke and healed. My body, my spine, my rib cage thinks that it is being attacked. So it's like having the pain of being a broken rib, let's say, or what have you. I can sit before you here without wincing and all that craziness, because I've been dealing with this pain for so long. It's second nature. It's not to be dismissed just because I can handle it. I'm handling it, I should say, but at the same time, I'm just used to it. So anyway, the body thinks that the bones are healing or being attacked, and they're trying to heal. So what they're doing is the signals are telling my body to build up more calcium. So I don't know how to do inserts or anything yet. This is my first video. So my rib cage normally would be like that. Let's just say this is the rib cage. There'll be all this extra calcium on the rib cage, and then they could fuse like that, which can make it difficult to breathe in. Even that breath hurts. But my SI joints, my spine, hips, stand the chance of becoming fused. Ergo the name ankylosing, like the ankylosaurus, the dinosaur that has the spine on the back where it's all together. And that's what a fully fused spine looks like. And that's how it got its name. I've really got to learn to put up pictures here and there, which I may try to do, but something here or there so that you guys can have a better idea. It's a really painful disease. It takes a long time. It took me a long time to get diagnosed. I am 54. I got diagnosed at age 52 properly. I got diagnosed at age 28 with fibromyalgia. And how my diagnosis came about this time was I was a coach bus driver, a job I dearly loved and miss. And one day I was stepping up into my bus, and I missed grabbing the rail, and I fell backwards out of the bus. And I hit that pavement like I just bounced. And I was really scared because I'd learned over the years that when I take a bad bump, fall, what have you, when my body receives a shock from a fall, it reacts in a flare. They call it flares. And I was like, I was really scared because I remember one time I fell out of the tub and I caught myself with my hands, like people will do, caught myself with my hands, and later on, the fibromyalgia, the pain, AS. I don't know if I don't know if I have both or just the one, but at the time I thought it was just fibromyalgia. I knew that my arms and my upper body were going to be in excruciating pain. So, and it's been that way throughout my 20s, 30s, 40s, and now in my 50s. So, when I fell out of that bus and bounced on that pavement all around, I was concerned. I was really, really concerned. And it took approximately 3-ish weeks, or maybe a little bit more, for the pain to really kick in. I remember I was trying to do I picked up some side gig work where you go into a store and you redo the displays, right? And I remember my legs were just hurting so bad, and I was like, I want to work, and I'm a worker. I'm not that person that calls out. I'm that person that drags her dead body to work and works. But the pain was, it was not okay. And I had to leave the job. And I'm carrying on. I have got an assignment coming up soon to drive the bus. And I remember day before I was laying on the couch, and the pain in my right leg, from my SI joint down my leg, was excruciating. I mean, I'm sitting here and I'm handling pain right now. Generally, you can tell from the bags under my eyes what kind of pain I'm dealing with, and I'm hurting right now. My rib, like I said, the rib cage, SI joints, I'm really in a lot of pain right now. So anyway, and I'm not crying, but the pain that day had me in tears. Tears just flowing. And there's a wonderful doctor's clinic near where I live, and they're 24/7 and not 24/7. They're like 12 hours a day. They're 7 days a week, and they're walk-in. So I went in there, and I had established a good relationship with this RN and or P, the one that's under the doctor. I can't think of it right now. Sorry, but I established a great relationship. She's wonderful. Absolutely love her. I went in bawling my eyes out, and she knew. She was just like, "You're crying. What's going on?" And I said, I told her what was going on. I told her about the pain from the SI joint down to the foot, and how I could barely walk, and that I had an assignment for work. And for me as a bus driver, our assignments ran anywhere from 3 days to 2 weeks. I can't call out for a day. If I call out, I'm calling out for the whole assignment, and I might not get another assignment until one's available, which could be anywhere from the next day to a couple of weeks. And I couldn't afford to miss that. So they gave me a couple of steroid shots in my leg, usually right around the hip and the leg, which took care of it for a couple of days. And from there, the pain just grew and grew. And I would put all these pillows in the seats and back supports and all kinds of stuff, and ibuprofen and CBD oils and CBD gummies and all types of stuff. And I'm like, I can't get this flare. And I'm still thinking it's fibromyalgia. I'm thinking I can't get this flare under control. I've got to see a rheumatologist. So I go back to the doctor's office, to the clinics, and I say, hey, please give me a referral to a rheumatologist. They do so. I finally get into the rheumatologist. She's running tests and what have you, and this took a couple of months. I'm condensing this. So I tell her, I have fibromyalgia, and what has helped before, it was tramadol, and please give me some tramadol. So she prescribed me some tramadol, did the blood test. She also gave me gabapentin and something else. And she's like, give this a try. They took my blood, they ran a panel. And when I went back, my life changed. Just changed. She told me I was pre-diabetes, and not just like on the low end of prediabetes, literally 4 points from full-blown diabetes. I was bigger than I am now. I was about 30-40 pounds bigger than I am now. And then they also told me that she says, you don't have fibromyalgia. She says you have ankylosing spondylitis. And she's from another country. And so she has an accent. And so I didn't quite understand what she said. And I was like, could you write that down for me? And she printed off a paper for me. And I went home and I looked it up. And I remember laying in bed and reading about this and watching these videos. And I bawled my eyes out, because this autoimmune disease, when I saw, at first I thought everyone fused. Not everybody fuses, but I do deal with the pain of like I'm going to fuse. Because remember, my bones are trying to build extra calcium, because the signals are telling my brain that we're under attack and we need more calcium on these bones to protect the bones, especially the spine, where your spinal column is, where your nerves are to your brain, and your brain wants to protect itself. So my brain thinks that my nerves could be damaged, so it's trying to build calcium. Or it's trying to, it's calcium. Bones are made of calcium, right? So it's trying to build up extra calcium, extra bones to protect the spinal cord. And this hurts. So I saw that, and I laid in the bed and I cried. I just cried, bawled my eyes out. The pain got so bad that all I could do was just cry. Pretty much all the time. I remember the pain going into my feet to the point where I couldn't wear normal shoes. I bought these shoes, actually found these shoes at Rainbow Fashion Store. These aren't even special shoes that you have from like the expensive highfalutin foot solutions, which I've been there before, because in the past I had the whole thing with the Achilles tendon and the arch and everything. We'll talk about that later, but another video. But they were like $200 shoes. These were $12, and they're like pillows. They're like walking on clouds. They're so soft. They're like the dad shoes, like the slip-on Birkenstocks. You know, obviously not the good ones, not the name brand, I should say, but these things are wonderful, and they're pretty much all I wear all the time. So I kind of invested like maybe $70 in a bunch of shoes, because they're just these little foam things that are kind of cheap, and they have, because I wear them to death. They wear out for me in about maybe 5-6 months. But they're amazing shoes. But I remember I would be in bed sleeping, never get comfortable. The pain was terrible. Getting up every morning and knowing, like, I remember getting up and trying to step on the ground and just about falling. I had to catch myself because the pain in my feet was so bad, like so bad. And I would have to wear those wonderful dad shoes. I pretty much changed my wardrobe around these dad shoes. I mean, maybe one day I'll get a really nice pair, as long as they're soft. They're the fashion right now, so I'm lucky with that. I guess I'm lucky with that. I do care how I look. And so yeah, I had to wear those all the time. Eventually, and then I got the shoes that I saw the nurses wearing. They're called the So-So tennis shoes. Those things are great too, so I will wear those. But it just got to the point where I can no longer work as a bus driver. And fortunately at the time, they said I could go in the office, which I did. And it got to the point where I bought a rollator, one of those, the little push rollators that you see the elderly use. I got one of those. It's a 2-in-1, so I could sit in it, and it's a wheelchair, and I could be pushed, or I can stand up and walk it. And I also got a cane. And I think I worked in the office for about a year, close to a year, and I had hoped to stay there. And they had hoped that I would get better. They hired somebody else to be in the office, like a manager over everything. They wanted somebody who could fix on the buses too, which I couldn't really do. So they told me, hey, you can go back and drive the buses, or we got to let you go. So I got laid off. I was on, what do you call it? It's not disability, unemployment for probably almost 6 months ish, something like that. And then I found a job being a caregiver with other caregivers for an elderly woman, but those were 12-hour shifts. She wasn't difficult to take care of at all. The situation just fell apart because there was one of the ladies there that worked there that was just very toxic. And I had gone to the doctor, the rheumatologist. Oh, she of wonderful news. I'd gone to the rheumatologist, and because I said, hey, I want to get on biologics. So I read all this stuff about biologics and how it gave people their lives back. And I'm like, I want my life back. So they're like, okay, we've got to do tests again. Every 3 months I get blood drawn because I have to have my kidneys checked and my bladder checked and my heart and things like just all the stuff, because I take a lot of medicine. So they have to make sure my organs aren't failing because of the NSAIDs that I'm on. Anyway, shucks. So yeah, so I got the blood panel done, and she says, hey, you cannot do biologics right now because you have tuberculosis. Man, I just felt like that 1-2 punch, obviously I can't fight. Anyway, and I remember right there in that kitchen back there, I just fell to the floor and just bawled my eyes out again. So went through all of that. They're like, hey, you tested positive for tuberculosis, but you can have active tuberculosis or you can have latent tuberculosis. Latent means that you're basically a carrier. I'll test positive for the rest of my life, but I don't have active tuberculosis. But they're like, we've got to do blood tests and we have to do chest x-ray. So okay, yay, I'm gonna go to the hospital and do the chest x-ray. And I go, and they're like, okay, you're latent, you're good. But I had called, being responsible, I didn't know I didn't have to, but I felt I'm like, where did I get this from? Maybe Miss Mary, the elderly lady, has it. Maybe one of the other workers has it. I need to let them know so everybody can go get tested and make sure they're okay. Well, that one lady I was telling you about, she just, oh my God, she made everything difficult. You can't come back to work. And I'm just like, honey, the health department said I'm fine. They said I could come back to work. I made a screenshot of my paper showing that it was latent. It's not contagious. I'm just giving you a courtesy. She's talking about, you need to pay me my testing. I almost said bad words. No. And so I left that job after I found another job. I now work from home. Yay. And I answer phones for attorneys. I work for a third-party company who has attorneys use them, and we answer phones. So that's what I do now. I'm very thankful for my job. It allows me to stay home, which is easier for me than having to get up in the morning. I'm a cat rescuer, so I have several, well, they're no longer rescued. They're my cats. I've got 14 cats and one dying dog. So this allows me to stay home with them and allows me to not have to spend gas money, allows me to not have to get up in the morning and do that whole rigmarole and all that stuff. So yeah, so I recently got referred to pain management, which is that's the thing. So so I'm doing that, pain management. Sorry, my light almost fell. Pain management. And so he's like, hey, I was on, I forgot, what was I on? He asked me if I thought it was helping. I was like, no, it's not. And he said, well, you know what, just stop taking it. We're gonna up your gabapentin. Here's some more tramadol. And so yeah, so that's what I do. Take tramadol twice a day, gabapentin 3 times a day. And oh yeah, also when I found out that I had that I was pre-diabetic, I also found out that my blood pressure was high. I have high blood pressure, but that's because of the pain. And when you have ankylosing spondylitis, you're at a 30% chance higher of a stroke. So I'm on amlodipine. Low dosage, I think it's just 5 milligrams, but it does the job. It brings it down. And for the pre-diabetes, to help me lose the weight, my doctor prescribed me Manjaro, and it worked great. I was on it for about 6 months, maybe less, but I lost the weight, and I've kept it off. I gained maybe 5 or 10 pounds back, but I've kept it off. Diet, and I do try to stay physically busy, even though it causes so much pain, but you have to keep moving. My doctor said they think the reason why I haven't fused, because I'm 54 and obviously I've had it since a teenager, they think the reason I didn't fuse was because I stay so active. I used to rollerblade and everything all the time, but I've been in a flare now for 2 years. 2 years. It used to be I would get a flare, it would last months. I would be able to get through it, and the way I got through it was I changed my diet and I did water aerobics. But I was also an at-home mom, and I had time to do that, and I had time to try to get some extra sleep. Now I'm not. He and I are divorced. Whole other video. So here I sit. And I wanted to make this video to help people, to help women, and then to help people of color, because this was, and it still is amongst many doctors, known as a man's disease, and it is not. So a lot of women get dismissed as having this. I can't tell you how many times, yet another video, how many times I've gone to a doctor and had to put on her ankylosing spondylitis, and they go, are you sure? Yeah. Or, who told you that? Excuse me? And then I have to give them the doctors, because I got 3 different opinions on it. So, and I failed out of physical therapy twice. Just couldn't handle it. I did the pool thing, and it was way too much. The one time they had to pull me up out of the pool because I was about to pass out. It was too much. They just kept pouring back, and it's too much. Everything is too much. Laying down is too much. This is too much. When I'm done here, I'm going to take off this nice white presentable shirt that I put on for you guys, and I'm going to put on my PJs, throw the hair up in a ponytail, and lay down. I guess it's time for another dose of meds. I honestly need more, but I don't know. Talk to the pain. I started red light therapy, and that has helped a lot, which is another video. But I do red light therapy from the chiropractor, and then I have a lesser red light therapy pad here at home that I use. So maybe I'll use that on the rib cage to help the pain today. But Oh gosh, I forgot what I was going to say. That's another thing, the brain fog. So, yeah, that's basically my story. I hope you guys have a good day. If you're feeling pain in your SI joints, especially, that's one of the telltale signs. Ask to go see a rheumatologist. Anyway, oh yeah, so the videos are, I want to help other people. Like, I've been helped by others who have put out videos like this. Because the doctors, they don't tell you anything. They're like, oh yeah, this is what you got. Okay, bye. I've got questions. And then I belong to a Facebook group called Living with Ankylosing Spondylitis. All right, I got to stop because the pain in my rib cage and my SI joints is getting worse. So no filter. I just wanted you guys to see my face in pain. Anyway, I'll do more videos. You all have a great day.